What happens when a child's pain is hidden in plain sight? Too often, we miss the signs before it's too late. That was true for a teenager I once worked with. He hid his pain behind a bright smile until one night, his anxiety spiraled into near lethal self-harm, and a mobile crisis team was rushed to his home. I got the call close to midnight. I could hear sirens in the background, his parents' voices trembling, and we were heartbroken, wondering how did it get this far? You know, I'd taken hard calls before, but this one stayed with me and became a driving force behind this idea. We need ways to identify what's wrong sooner, before it turns into a crisis. This child's story also revealed something much larger, that what we often call a tragedy is actually a failure, especially when it's predictable and preventable. We wouldn't wait for a child to have pneumonia to check their lungs. So why are we waiting until they're suicidal to check their mental health? In the United States, pediatricians are encouraged to start screening for anxiety at the age of 8 and depression at the age of 12. But these screeners don't always happen, and they only reach kids who make it to annual checkups. Those most at risk, whose families are under stress or lack access to care, may never make it through the door. If we are ever going to do something about the youth mental health epidemic, we need prevention with clear paths to support and early screening. So, what exactly is the solution? Well, there are international models already working in other countries like Portugal, Sweden, the UK, Singapore, and Australia, just to name a few. Portugal's approach stands out for its intentional response to crisis. In 2017, a rise in youth suicides led to a national effort to include mental health screeners in schools in the school health program, right alongside height, weight, and vision. Trained teams use brief, validated questionnaires to identify concerns and notify parents early. And you want to know the exciting part? It's working. A 2024 study revealed that these screeners are leading to faster access to care, earlier identification of issues, and reduced stigma, making mental health a routine part of whole child care. Now let's take a moment and imagine this happening here. A 7th grader pauses before checking rarely on feeling connected to school, and then marks almost never for hope about the future. That one moment opens a door. His parents are notified. A counselor follows up. Someone's listening, and he's no longer alone. Now, I wonder if you knew this. In this country, state health authorities, including the CDC, the American Academy of Pediatrics, and the National Association of School Psychologists all already suggest that we be doing these mental health screeners in schools. And yet there's still no federal law mandating it. And implementation is left to states, leading to inconsistent access nationwide. Now, the good news is a few states are stepping up. New Jersey leads with fully funded depression screenings for grades 7 to 12. Illinois links optional mental health checks with school physicals. Colorado and Utah have both launched statewide programs, with Utah screening over 10,000 students last year, connecting more than a quarter to care. While other states are stepping up and also piling efforts, they're often a lot smaller, and still only 1 in 5 schools is conducting any sort of mental health screening. Proactive check-ins still aren't the norm, and that's exactly what needs to change, which is where the Department of Defense Education Activity, otherwise known as the DODEA, comes in. Its schools serve more than 66,000 military-connected kids, and is uniquely positioned to pilot a check-in system that could become a national model. Now, why is this so important? Because these kids oftentimes are left unseen and unheard. Many of them struggle. They often have a 50% higher chance of mental health issues during parental deployment. Many of them move 6 to 9 times before graduation, carrying the constant weight of change and the unspoken expectation to stay tough. And yet, they're among the least likely to receive consistent mental health support. Why? Because frequent moves disrupt care. Because they don't want to stand out. Because they think they have to be tough. So, with the DODEA, did you realize that because it's federally run, we don't need all 50 states to agree? One system, one smart shift, has the potential to ripple outward into public schools, clinics, and communities. In fact, the US Senate recognized this potential in 2023 when it introduced the Supporting Mental Health for Military Children Act, proposing a pilot program for routine screenings in DODEA schools. Unfortunately, the bill is no longer active. To be honest, it literally died 2 months ago. Why is this important? It's important because it matters, but also because they were trying to do a lot at once, including diagnostic assessments in the school and setting up with outside providers. It was well-intentioned, but it faced real barriers, such as staffing shortages, privacy concerns, and logistical complexity. What we are proposing here today is a more feasible first step, one that can build on legislation and move forward now. Inspired by Portugal, we can start with brief, validated check-ins, not to diagnose, but to listen. Imagine this. If we started with someone, a student sitting in a classroom, quietly answering questions like, do you feel safe in school? Do you feel like you matter to your teachers? That is the power of small. A simple screener has the ability to catch what others miss and maybe even save a life. And while follow-up can feel overwhelming, research shows that early screening reduces risk, reduces cost, and reduces suffering. And that's also why a system like the DODEA is an ideal starting point, because it already has counselors, transition supports, and the military student identifier to help support its students. A pilot could build on this and align with core American values like choice, privacy, and early support without overreach. And importantly, screeners would be opt-in with full parental consent and transparency, ensuring that families remain central to the process. Let's make check-ins the norm, not just a crisis response. Because too often we miss the signs, and the stakes are so much higher than people realize. According to the Secret Service's National Threat Assessment Team, nearly every single act of school violence included a student who had shown clear signs of distress that were either missed or misunderstood. Early screening isn't just compassionate, it's essential for helping our children feel safe in schools. And what about kids outside DODEA schools? Maybe they're skipping meals, obsessing over perfect grades, or thinking no one would care if I were gone. These aren't just moods. These are signals. Whether military connected or not, a screener can help us identify what's hidden before it's too late. And like so many other parents, I carry a quiet hope every time my child packs their backpack for school. Please let them be seen. Please let them notice if something's not okay. And I also understand the importance of protecting our children's privacy, and I would never advocate for anything that excludes parents, as caregivers are often the first to recognize when something's not okay. And so we deserve the tools to identify it, including the right questions to ask, such as, are you eating and sleeping okay? Have you been pulling away from friends or activities you used to enjoy? Have you been suffering from a lot of headaches, stomach aches, or trouble relaxing? Do you feel pressure to be perfect? Have you ever thought, no one cares about me? It takes courage to ask our kids these questions. These questions are not easy. But when we're equipped to listen, we can act before things get worse. So here is where you all come in. If you're a parent, you can contact your child's school and see whether mental health screenings are something that are available or could be. You can also regularly check in with your child and make sure that they're okay. If you're an educator, you can explore what's working in other schools or see whether a screener like the one proposed today could work for your students. And if you are anyone else who cares about our children's mental health, you can contact your local representative and see whether mental health screeners in schools are something they could add to their policy agenda. Let's turn momentum into action and make routine screeners the norm, not the exception. Because that is how we will finally make mental health normalized and understood. And the encouraging part is that we already have the research, the models, and the infrastructure that shows it works. Routine screeners, they're not just possible, they're practical. And honestly, it's shocking that we haven't started sooner. Please, don't wait until it's too late. Watch for the signs. Because when we don't act, we risk so much more. We don't just miss opportunities, we risk losing lives. No child should ever have to wonder if anyone sees them. Let's be the ones who say, I notice you, I'm here. Let's show them that they matter before the breaking point. Thank you.